is a group of diseases involving abnormal cell growth with the potential to invade or spread to other parts of the body. According to the National Cancer Prevention and Control Plan 2018 to 2022, cancer is responsible for 72,000 deaths in Nigeria each year, with an estimated 102,000 new cases annually. Hello and welcome to the program Health is Wealth. I am Mariam Abubakar Kana. On this week's edition of the program, we will be talking about cancer. Let's meet our doctor.
My name is Dr. Chikadibia Ukoma. I'm a consultant hematologist with Federal Medical Center Keffi, and also the founder and executive director of Leukaemia-CarePlus initiative.
What is cancer?
Cancer is a disease condition where there is a increased proliferation of cells. The cells continue to divide and divide out of proportion, and it's uncontrolled. And then the organ where the cell is begin to grow in size too, and they may begin to compress other organs. And that's how it manifests its symptoms. Normally, every cell in the body grows and divides. At a point in time, since they feed, they divide when they get to their maturity age. And when they divide, they die. And after some, they also die. But in cancer, the cell continues to divide and does not die. That's what we call it immortality. Sometimes it assumes immortality and so does not die. It keeps on dividing. The normal mechanism that controls cell division is no longer taking place. So the cell continues to divide at a very fast rate. That rate of sequence of growth to a point before you divide is broken. And the cell continues to divide. That within a day, one single cell can turn into millions of cells. So that's what cancer is. So cancer can affect almost every organ, every cell in the body. And it can occur at any time. Can affect a man, can affect women, child, adults, elderly, even babies are all prone to having cancer, as long as you have a cell in you that divides.
Who is at risk of getting cancer?
Everybody is at risk. As long as you are living, there are living cells in you. Even when there is even no thing that precedes it, the active part of going through the gate to divide can damage the cell, but can damage the gene of that cell, and that's what begin to divide. And the people who are more prone are those who work with petrochemical companies. Okay, those who work around where there's ionizing radiation, those who got exposed to ionizing radiation. If you take what happened in Japan, in Hiroshima, during the atomic bomb, most of those who survived eventually developed leukemia and other cancers because of the effect of that high tension energy, which damage the genes in their cells, so they become cancerous. There are also infection agents like viruses can also cause cancer. So those who get infected, like hepatitis C, hepatitis B, when it is not properly treated and then I think to a chronic stage, can turn to cause liver cancer. Then we have one of the cervical cancer is also caused by human papillomavirus. That has also been identified. And so, in fact, a vaccine has also already been produced to help to prevent this in women. The Union of International Cancer Control, UICC, is championing this. In advanced countries, this is already a routine for young girls to get this human papillomavirus vaccine. But Nigeria is still, we are still struggling and hoping to get there. The vaccine is already available, but we need the funding and what it takes to actually, disseminate it to the general public so everybody can be easily access it. Our government can play a big role in that regard. It's already available in Nigeria. It's already available. But you know, there had to be a chain, a mechanism of distributing or disseminating it, so that it now becomes a mass something. Though if you are interested, you can always get it to buy and for yourself. We are hoping after this World Cancer Day celebration, Nigeria Cancer Society is involved in that, so we can be able to find a way of actually disseminating it with the help of government to disseminate this drug, so that it can become, government can make it free, so that every child, every young girl in Nigeria should be able to get. Now, the US is also championing having to eliminate cervical cancer, so cervical cancer can be eliminated. So in other countries, they have keyed into it, they're already doing it. But Nigeria, although we have keyed in, we are part of the program when it was launched in November. But the act of actually implementing it is where we are actually lacking behind. So we need that synergy, that energy to be able to government to play a bigger role, make the vaccines available, create the chains in which they can be actually distributed to every Nigerian child.
How does cancer start?
It starts from the gene. Gene is you can't see gene with your eyes. Gene is a component of the nucleus of the cell. Any cell that have nucleus have a gene. Just genes are located in the chromosome of those cells. So that's where the damage occurs. And when that damage occurs, there's a cycle, what we call the growth cycle. G phase and B phase growth phase. Okay? Then SF is the synthesis phase. So you have to grow, synthesize, and then now go to the point where you now divide. Okay? So it has to pass, most time, if what the body does, like what we call gatekeepers in the body, like what we call G50, around that area where the cell goes to division. Ideally, once that G50, those gatekeepers, identifies a damaged cell, they are likely to turn into cancer. They eliminate it, they throw them away. You don't allow them to cross the divide. But when cancer, that's why I say, sometimes when they break through, cross that gate, they now become cancerous. So when that damage is now happening, they now acquire some mechanism to overcome those gatekeepers. They now pass through. That's what cancer. So cancer can, when it starts dividing, the cell now begin to divide. Okay? When the cell divides, when it becomes millions, the organ now begin to get bigger and bigger and bigger and bigger and begin to compress other organs.
Does cancer have symptoms?
Yes, cancers have symptoms, but it depends on which organ is affected. Okay? The main problem with cancer is they grow. And every cell that grows needs food. The food you are eating is you are eating for the cell. The cell use those food, glucose, and other proteins to build and divide and grow. So what happens in cancer, what they do, they collect most of the things you eat, the food nutrients you eat. And so what you have most time, people are going to lose weight. That's why those who have cancer tend to lose weight. Okay? And I mentioned again compression syndrome. When the organ becomes so big, you need to compress other organs. Okay? When you compress those organs around there, you begin to have pains. And then the other organs won't be able to perform their function again. Like in the case of blood cancers, blood cancer cannot grow to become a mass because it's a liquid form. Okay? The blood itself does not grow. But it is the cells that grow. That the white blood cell, most likely in leukemia, that actually grows. And when it grows in the bone marrow, what it does is suppresses the production of other blood cells, like the red blood cell and the platelet. And when that happens, the person begins to develop anemia. Okay? Anemia begins to feel weak. There's weakness, there's tiredness. Before you trek up to a pole, you are tired. You want to stop and rest. That's what an anemia does. The person will need to transfuse again. Then when it begins to affect, platelet is not being produced again, the platelet is what prevents us from bleeding when we get an injury. When you are given an injection or something cuts you have a little wound in your body, once you press your hand in it for a few seconds, you move your hand, the blood doesn't flow again because the platelets are lined up the exit points so the blood does not flow out again. Now, when the platelet is low, the person can bleed, can even bleed in the brain and die. So that's the most critical point. And then because the white blood cells that are being produced in excess are not performing their role, they lost their ability to perform the natural role of defending the body. So what happens now? The person begins to have infections. So you have fever, may have cough, may have diarrhea, may have a headache. So you can present it, but most times it is people as fever. Okay, so I can present a bleeding. Then begin to bleed from other points. You see a big mass organ in the body. Maybe in the breast, you might see a big you might start like a small mass begin to grow, and then may become ulceraceous, become ulcer of the skin ulcer may become like a wound, big wound, keep on growing and getting wider. In lymphoma too, you also have swellings around the neck or around the armpit or even in the abdomen. So a cancer can present in any form, depending on which organ is affected, and that also determine the kind of symptom the person might get. I'm just giving you the symptoms, the early symptoms of blood cancer, because what we do is our work is we are focusing mainly on blood cancers. So that is my area of specialization. So that I could give you those ones. But depending on which organ is affected in the body, then of course they can present with that kind of symptoms.
What are the stages of cancer?
Yes, cancers are also in stages, grades and stages. Okay, depending on which organs you are talking about, which cancer you are talking about, there are grades and staging. Each the cancer group in the world has their way of staging. Like in lymphoma, you have grade 1 when only one group of lymph node, maybe only one in the armpit is affected. When you get two groups, like maybe they have in the neck, you have in the axilla in the same part, that is stage 2. Then if you're now crossing the diaphragm, you have 2 up and 1 down, you're going to stage 3. And stage 4 is when there's naturally has involved other organs and involving the skin and cutaneous areas. But for leukemia, you can only have mild and severe disease, because there's no organ being affected, except when it is now drained into the skin or into the other organs that begin to affect those organs. It can affect the liver, can even have the spleen. So that area can become like in CML. You might have masses around the arm, on the skin. Those ones you can have the chronic phase, the accelerated phase, and the acute phase.
How quickly can cancer spread?
Like when you talk of lymphomas, okay, what we call it, the indolent lymphomas. Those ones grow very slowly. Okay, they grow before it may take years. The lymph node may start in one lymph, and they may take maybe years before it now affect other organ, becomes that serious. Okay, but in the acute ones, or those one we call those who are the other ones which begins today, before a week or month it has become so big, like in leukemia, acute leukemia, they start and then progress rapidly, and if not treated within 3 to 6 months, the person is dead. But like chronic myeloid leukemia, person may be having it, but not even know they have a disease, anything at all, because it grows slowly. Okay, it may stay for years. Some people come, the only when we identify them, when they come for maybe for a checkup, maybe they are going for the military or police recruitment or recruitment exercise, and I say go and do your blood test, and you now do your blood, you now see that the white cell is over 100. That's supposed to be less than 10. So over 100, they will be able to catch them. Or most times for chronic leukemias, like chronic myeloid leukemia and chronic lymphocytic leukemias, they might stay for years. You may not be seeing anything. Okay, but the acute leukemia, acute myeloid leukemia, and acute lymphoblastic leukemias, those ones happen rapidly. Within 2 months, if not treated, it becomes too bad.
Is cancer genetic?
Well, genetic, I would say yes, because it's having in the gene. The damage is done in the gene. I would say yes, it's genetic. But what are you saying? Whether it is hereditary? Yes, there are some cancer that you can inherit from parents, okay, or from family. It may not be directly for your mother or for your father, but because the father have that gene, you may begin to manifest. Your father may not have a cancer, or your mother may not have cancer, but you may have. Maybe because the gene has there, maybe the grandfather or great-father has one. The gene is there, so it may affect anybody within that family. Once that gene is activated, it may become cancerous. But in some people, they are lucky; they escape it because that cancer gene was not activated, so they can escape having that cancer while they are alive. But somebody who maybe their child may eventually develop cancer, like that of the breast cancer. Breast cancer kind of has a family history, okay. But for blood cancers, it has not been identified as they are linked to it cannot be inherited. Most of it, they are just spontaneous damage to the gene that occurs.
Is cancer contagious?
No. Cancer is not contagious. Like I said, it is a damage. Most of it is spontaneous. What I call spontaneous damage. So once it happens, it begins to divide. It cannot be transmitted to another person. It cannot be you are taking care of somebody. You cannot get it by taking care of that person or staying close to the person. Those are affected by infectious agent because it's not infectious. The only part of cancer that I may say may be infectious, like those ones that actually have causative organisms, are from viral infection, like the human papilloma virus. Okay, if it's transmitted to you, then of course you may eventually develop that cervical cancer. If somebody transmit hepatitis B virus to you, those ones are infectious. Okay, can be gotten from somebody. Okay, eventually if you have contracted that hepatitis B and you didn't treat it properly and it has become a chronic, eventually it may likely, not all the time, but you person is likely to develop hepatocellular carcinoma.
Is there a vaccine for cancer?
I just mentioned one that you have the vaccine. For actually two of them. Hepatitis B has a vaccine which can be taken. Human papillomavirus vaccine have been developed against cervical cancer, and that's why we have hope that cervical cancer can be eliminated. Maybe in the next 10-20 years, we may not be having cervical cancer in some developed, those who are actually serious in dealing with it. You may not have cervical cancer again, or even if there's very few. Okay, but for others, it is not, since they are not done, you cannot associate cancer with infection. It's difficult to say create a vaccine.
This is how far we can go on the program. Please be with us again next week for the concluding part, where Dr. Chikadibia Okoma will be telling us about the causes of cancer, whether cancer has a cure, and the fight so far against cancer. Thank you very much for watching this week's episode. Do have a pleasant night rest. Goodbye.